does sound like communication, at least for you, among, peers and these boards that you may need to get in contact with, and just sort of the larger, networks of people, that you require contact with day to day. Has that been a challenge? Because it sounds like you've had, at least, obviously making adjustments, a pretty smooth transition from, physical in-person contact or regular contact to, now this more virtual, over the phone, over telemedicine. So, and clearly sharing this article is, another example of that communication, a way to communicate with your peers. Have you found that, the community as a whole has adjusted well to this and quickly to this?
So I can't speak for everyone. I mean, and I would never say that this was a seamless transition to telemedicine and that everybody's been happy with the, on the patient side has been happy with the limitations in care. But I will say the American Headache Society has really been extraordinarily helpful at facilitating us being able to put this together, to be able to communicate quickly with what I think are useful guidances and advice to help our colleagues who are managing this. I don't have the benefit of a questionnaire or a survey to tell you exactly how people are doing. I think the postmortem on how we've done collectively for this will be probably written in 6 months to 12 months. But overall, I think that the responsiveness or the feedback I've gotten from my colleagues is that they're being able to manage transition to telemedicine pretty well. Mm-hmm. And I hope that the things that we were able to put together prove to be helpful advice for them.
And now, have you heard, obviously, there was a major plea to the insurers, as you spoke about earlier. Has there been any response? Obviously, like we said, it's only been about a week and a half, so maybe perhaps not the longest time, but have you seen any response either from the insurer side or at least from the, physician side in agreement? Have people been clamoring for, to sort of make the noise louder to hear?
Yeah, so I have not had any direct feedback from any private payers or from CMS. We reached out to CMS to confirm their guidance about coverage of medical oxygen for cluster headache patients who are Medicaid and Medicare beneficiaries. We have not heard back from them directly. My communication has been very, as I mentioned, has been very good with our Vermont-based Medicaid folks. I don't know about the private payers. I agree. It's too early to really make a statement about it, and I haven't heard feedback from my colleagues out across the country about how they've been faring with this. It's a challenging time.
Yeah, and obviously, you've alluded a couple times to sort of these difficulties with patients, and whether it's a cluster headache patient who's struggling now to get access to the oxygen that they need, or whatever it might be. Aside from just the limitations in actually getting patients, the treatments they might need, an ongoing conversation in headache medicine always seems to be that, patients with migraine who end up in the ER, and you did mention earlier that, sort of that's been part of the approach to make sure that these patients aren't crowding the ER in this time. Has patient education has that shifted in any way, just in sort of instructing patients on if they do have an attack and don't have access to, one of these new acute medications, on sort of how they can best manage it while keeping themselves out of the hospital?
So my interactions with my patients via telemedicine have been almost uniformly that they understand what the circumstances and constraints are. I don't think they're expecting us to be able to remove this COVID cloud, which will permit them to get the care that we'd like to be able to provide them immediately. And almost uniformly, they've been grateful that we've been finding another way to reach them to be able to provide care. And so I think in general, there's been a cooperative attitude on the part of everybody to try to make this as good as we can make it under the circumstances. And I think that's a positive out of a very distressing situation, which we're all living in.